Hi, my name is Grace. I'm a junior Liberty nursing student, and I'm checking off on Ruben, and today is September 11th.
I, Jacob Palmo, hereby give my written and verbal consent to be filmed in the Liberty University nursing exam suits in the nursing department at Liberty University as part of the Nursing 210 Adult Health Assessment Nursing 221 Fundamentals of Nursing course. I understand that in giving my consent to be filmed, I also give permission to the film containing my image to be submitted to a secured YouTube site viewable by the nursing student and instructor of the course. I understand that during the examination and filming, areas of my body will be uncovered, exposed, inspected, palpated, percussed, and auscultated by the student nurse. With this understanding, I give my consent. September 11th, 2014.
Awesome. Hi, Jacob. Nice to meet you. And your date of birth?
January 25th, 1993.
Awesome. So today I'm going to be assessing your head, neck, and lymph nodes. And I'm going to start off with the head. So upon inspection, I can see that the face and the head is normal cephalic. It is symmetrical. It is atraumatic. And I can see that the head, the scalp is, upon palpation, is freely movable. And if I touch these areas, this is the maxillary and the frontal sinuses. Is there any tenderness there?
Not at all.
And any tenderness on your jaw? Okay. So let's begin with your TMJ. I'm going to ask you to drop your jaw and then close and bring it forward. All right, and side to side and up and down. Okay, and then resist my thumb. Okay, and you can turn towards my hand and I'll just have resistance towards your turn of the face. All right. And the other side. Awesome. So I can see that, you know, it's symmetrical. There's no problem for him to turn his face. I can see that the sternocleidomastoid also has no distension. Okay, so if you could resist me pushing down on your shoulders. Awesome. Okay, so I'm going to assess your trigeminal cranial nerve number 5. So I have a sharp and soft end. This is the sharp and this is the soft. And if you close your eyes, you can, if you could just verbalize what you feel.
Sharp. Soft. Sharp. Soft.
Okay.
Soft.
Awesome. So everything is normal findings. And I'm going to assess facial gymnastics. This is cranial nerve 7. So if you could smile, smile without the teeth. Frown, puff your cheeks. Now have a tongue on one side of the cheek. Awesome. And puck your lips. And raise your eyebrows. And try to resist me from opening your eyelids with your eyebrows raised. Here we go. Perfect. So that is the normal findings as well. I'm going to now start in inspecting the lymph nodes. So the anterior and the posterior auricular nodes. Okay. Use the occipital, submental, okay, sublingual, submandibular. Okay, and then anterior cervical. Okay. Posterior, and then deep. So I feel no nodules or any calcifications. And if you could stand up, Jacob, I'm going to palpate your thyroid. And if you could raise your chin and swallow. Okay. And you can turn your head to the left. I'm sorry, tilt your head to the left. All right. You can go ahead and tilt your head to the right. So upon palpation, I feel no calcifications or nodules. You can go ahead and sit right back down. I also noticed that when he was smiling doing the facial gymnastics, there were no tics on the face. Everything was symmetrical, no drooping when he was smiling. And other places, non-palpable, if this was the supraclavicular lymph node was palpable, that would be an indication of a metastatic disease in the thoracic or abdominal area. Normally that is not palpable. Another place to inspect is the epitrochlear, which is the meeting of the tricep and bicep, and the popliteal, which is the back of the knee. And to assess those, I would have to have him in a position like this where the knee is flexed, or in a flexed position. And if I can just have you right there, okay. Lymph nodes, upon inspection, were not matted. They were not grouped. They were freely movable, and I didn't feel any abnormalities. I'm just going to assess your temporal arteries to see if there's any abnormalities or bruise. Okay, and the thyroid. If you could hold your breath. Okay, so I don't hear any bruising. That's a good indication that there is no hypersecretion of any hormone that the thyroid would secrete. If there were, that would be an indication of hyperthyroidism or any other disease. And I guess we're done.